October is Breast Cancer Awareness Month, and every Monday during this month we are focusing on awareness on breast cancer through brave stories of successfully battling the disease and sharing essential information that can empower you to seek diagnosis and treatment at an early stage before the disease spreads to other parts of the body.
Budoni, do we need to get a doctor's report, or anyone can just walk in?
So for the clinical breast exam, you can either go to your obstetrician gynecologist or walk into any district hospital. They have the capability of being able to screen for that.
Yeah.
And then what ends up happening is even a clinical officer, they would be able to pick out and find that there's something not normal. From when they will be able to refer you now to the specialist, who will do confirmatory diagnostics for them to confirm what exactly was it that they found.
Okay.
So any healthcare provider in the healthcare system should be able to pick out some of these basic signs and symptoms and then send you up now for referral to a more specialized person to confirm.
From your diagnosis with breast cancer, the cells were malignant when they were detected. Did that mean you had to undergo surgery, or what happened?
Once I was sent in, after the screening was done and they confirmed that there was something, I was sent in for further diagnostics, and they confirmed that yes, it was breast cancer, and at that time it was in late stage 1. And once the doctor was able to walk me through what the treatment plan was, one of the treatment plan that I was given was initially going for surgery. Then once I was done with healing the wound, I could start my chemotherapy, which I did, and then finished up on with radiotherapy sessions. So initially the surgery that was done was not done very well, so I had to repeat it again for a second time, which has, yeah, it's one of those things where you're dealing with something heavy, and you're ready and you're set and you're mentally ready to tackle this challenge, but you get setbacks like that. You get setbacks like something was not done correctly, or even your body reacts differently. At times, once you start your chemotherapy, your immunity will fall so low that you're not able to continue with your chemotherapy until your immunity goes back up, or you get some side effects that were not able to allow you to continue with treatment. So there's what you set out with your doctor, where he tells you, oh, within 6 months we should be finished with the entire course of treatment. But then because of the little setbacks that keep cropping up, you would find that something that was supposed to have taken 6 months would take up to 8 months to 1 year, just because you could not go in as per the program. There's the program that is set in theory, but on the ground, things are different. You find that you'll have to either take, instead of a 2-week break, you have to take a month off to either find more money or make sure that your body is ready for you to be able to take the next session, or just having somebody who's there to support you, to take you for the appointments, to make sure that your nutrition is still at par, and making sure that your body is healthy enough to be able to take the treatment that is needed for that time.
You said your first surgery was not done well. Why? What did they explain?
So there's something that is called, once they do the surgery, they're supposed to make sure that the entire lump is removed. That did happen. And initially I blamed the doctor, but at the same time, with years of just going back and looking for facts and figures and understanding what the environment looks like, you get to understand that at that time, the healthcare system had not been supported adequately to be able to carry out proper systemic checkups, and the doctor who was dealing with at that time was in a rush. We did not take that time to get to understand my condition properly, get to understand what was needed, how big the margins needed to be. So it was a human mistake, and it happens. But what ended up happening is that I ended up now not just relying on one doctor's opinion, but getting multiple opinions. So you have a multi-sectorial group that is bouncing off each other's ideas and getting the best solution that works for you. Because what works for me doesn't necessarily mean it works for somebody else. And that was a mistake that I made. I assumed that breast cancer is breast cancer is breast cancer, that it's the same for everybody. But you end up finding you could have 5 women seated in the same room, all breast cancer patients, but they all have very different breast cancers, number one, which means even their treatment plans are also slightly different. So each treatment plan is tailor-made for an individual with a general guideline.
Philip, could you tell us of the other experiences on the toll that cancer takes on the physical and mental well-being of other women you have worked with?
Mudhoni is one of them. But again, so there are different psychological needs for patients at different stages in their treatment journey. So for example, we can use Mudhoni's experience of being diagnosed, the diagnosis point. You know, she was worried about what next, how long am I going to live? So there are things to do with life, you know, am I really going to survive? So we are able to address those life issues. And then of course not just address, but also educate the patient that this is the treatment process. Sometimes people go through stigma, anxiety, and fear because they don't know what next. And unfortunately, the doctors sometimes are very busy, so they don't really explain to you adequately that this is the treatment process you're going to take. We'll do surgery. After surgery, you'll go through chemo. After chemo, then you'll go through, of course, hormonal therapy. So if people are explained to well, then they are mentally ready. Like Mudhoni was saying, there's what you're told, classical textbook treatment protocol, and then there's what is reality on the ground. So for example, with her experience, she was mentally prepared. But then in the process, there were some mistakes that happened, which then of course, then she had to readjust her mind to know that this is going to take a while. And then of course, there are many people who go through that. We have many patients who have been mishandled. Of course, it depends where you go to. So it's really important for the patient, number one, not just Mudhoni, but other patients that I've worked with. Number one, we take them through the process. We tell them this is what to expect, because I don't work alone. I work with the doctors. And there's something Mudhoni said, which is called multidisciplinary teamwork. In that teamwork, we have an oncologist, like Dr. Komen. We have a nutritionist sometimes, and then we have a surgeon. So it's a multidisciplinary teamwork. And we have a nurse, and we have a psychologist. They will discuss the case. Each person will bring in their points. So this is not happening in many hospitals. So I think this is something that we can try to work on, to make sure that the doctors consult among themselves, bring a case, discuss the case, and ask others, the surgeon, what do you think about this? The radiation oncologist, what do you think about this? And they also have to look at the age. So it's really important for us to do those. Unfortunately, they don't happen in many hospitals.
You know, and it is really sad, and I agree with you. They need, you know, that it needs to be very organized so that they don't, you know, they don't destroy the life of the patient.
Yes.
Mudhoni, what was the procedure in India, and how long did you have to stay in New Delhi?
For me, India was something that I had to do because at that time, I remember the first time I told you that I did the surgery, it didn't come out too well. And again, I lost hope. And I listened to advice that I was given that the only place you can go and get reliable healthcare is in India. So that's where I ended up. And initially I was there for a period of about a month, just to get the surgery done again. And then again, for when I was doing my radiotherapy, since I still had to go back for review, is also where I ended up having to do my radiotherapy. But that said, now it's, and this is a learning lesson that I've gotten over time. I am very factual and logical in the way that I handle my condition. And one of the things that I follow up on is just trying to understand what the Kenyan system looks like and what is available locally, because then not everybody can be able to go to India. With the COVID space that we had right now, where technically for almost 6 months, you could not go anywhere, what were those resources that were available for you to be able to, one, still either continue your treatment journey, or two, in case of financial restrictions, is there anything in Kenya that is available for you to use that still has the same level of expertise as what is in India? And I got to learn that one of the things that we have a shortcoming in is that we don't have access to that information. You find that the common Athiambo, the common Wanjiko, doesn't have information to know that there is a center at Eldoret that handles that. There is a center in Meru, there's a center in Nyeri. So they all know that if you get cancer, you have to come to Nairobi. And yet Nairobi was on lockdown in the first few stages of COVID. So what does that mean? And one of the things that we really emphasize on as Cancer Cafe is just letting the masses know where these resources are, where these services are, so that you don't have to keep driving for kilometers. You use so much money, and yet you've left a center right next door that offers the same service, that is also reliable, and working within a network of, like what Philip has said, different people, from nutritionists to your psychologist, to your doctor himself, to the gym instructor who's going to be able to tell you, please don't run 5 kilometers today, your body is not going to be able to handle it. Do 1 kilometer, let your body recover. To your church leader who is able to articulate the needs, your spiritual needs at that time. To your community leaders, because there are aspects of stigma that are linked to cultural beliefs. So when you get your community leaders who will be able to come in and say, you know what, as a community, this is what we believe culturally, but we can amend it a little bit so that we're able to accommodate people who are living with cancer for them to have a good quality of life. So you're able to accommodate them and integrate them into that society instead of separating them and keeping them aside.
What Budon is bringing about community awareness is very important, because stigma is fueled by community misinformation that they have about cancer. So it's really important for us, number one, to educate our community leaders, to educate the church leaders, so they know that cancer is not sin. Cancer is not witchcraft, you know. Cancer is a physical disease. Because if we are able to educate these people, then they also know the kind of support that they are going to give. Because I've had many patients who say, I don't want everyone to know but that I have cancer. Because when they know that I have cancer, they know that I'm going to die. And I've had men who actually, the kids start fighting about their properties because they know dad has cancer and is dying. And this is something that if we educate the community, then the community will know, how can I be of service to this patient, my mom, our sister, and our brother, without really looking at them that they're dying, without giving something that is very common, unsolicited advice, you know, unsolicited. Unaambiwa, sasa uko na cancer, endo ufanye juicing, nitakusaidia. Kula nyasi, wachana na hii. You know, a lot of things that I hear in the community. Ask this person, how can I be able to help you? And then get a professional to be able to give you the support. And last, treatment is available locally. We don't have to go to India. You can get your treatment here. The government has really expanded the treatment. You go to Meru, there's an oncologist there in Meru. When you go to Kisumu, there's an oncologist. When you go to Eldoret, there's a big cancer treatment center there, and they have their radiation machine. It's actually arrived. And then when you go to Mombasa, there's a chemotherapy center. So these centers are there. They're accessible to the common mwananchi. Usiweke watu kwa harambe that unaenda India. You can get treated locally.
Could you tell us about the Cancer Cafe?
Technically, it was a brainchild of just what I was going through as a patient and what I never wanted anybody else to go through. So I used my crisis as a learning lesson and came up with a platform that enabled other people living with cancer, either as patients or survivors, and their family members, to be able to understand what is this monster, what is cancer, what is exactly is it, what are the risk factors, how do we even manage it, and not just managing it at the hospital level. Because then you realize there's this misconception that cancer too, uyupeleka tu hospitali. There's no way you can deal with it at a household level. But then you get to understand that some of the interventions are things that we can control from the house. The food that we put on the table, the stress levels at home. Are we being able to exercise at home? Because all these have effects on the outcome of that patient and the treatment that they're getting. And just being able to articulate what is oncology. We're assuming that everybody understands what these medical terminologies are. And you get to find out that once in a while, whatever the doctor will be telling you will be the accurate thing, but whatever you hear is something completely different. So something like radiotherapy, which loosely translated into Swahili means kuchoma, if you back translate that, somebody else will understand it that you go and get burnt. So you end up finding somebody who will refuse to get radiotherapy simply because their understanding of what radiotherapy is completely different, is completely wrong. So what we normally do is that we get the healthcare providers out of the hospital settings and into the community. So you sit in a baraza, you sit in a shop, you sit in a cafe, you sit in a church, you sit in a school with the doctor and have that conversation with that doctor. You have conversation with policymakers, you have that conversation with the NHIF, you have that conversation with nutritionists, and they get to articulate their needs at that level and get to understand their challenges and solutions at that level. Then you're able now to internalize that and incorporate it even at household level.
A big thank you to you, Modoni Mata. She has a fascinating personal story of surviving breast cancer and her journey of healing and offering support to other people diagnosed with the disease. She's the founder of the Cancer Cafe, an innovative platform that bridges the gap between healthcare providers and their patients and caregivers over a cup of tea. And then we also had Philip Odio. He is a clinical psychologist with the organization Faraja Cancer Support Trust, and he is dedicated to working with the people diagnosed with cancer, offering emotional, practical, and healing support. Thank you so much for sharing your thoughts. Just a reminder that October is Breast Cancer Awareness Month. The theme of the month is Give Hope, Save Lives.